So is there anybody, rather than me sitting here, because I could keep talking, but does anybody want to, because I saw people nodding and you know, while I was talking. I mean, is there anything that you can add about some of the psychosocial issues that you may have dealt with and sort of how, you know, how perhaps you've coped with them or some of the issues that you still have in terms of, you know, meeting your own needs. You know, people, we are meant to be interactive beings. We have needs, emotional needs, we have social needs. And that doesn't stop when somebody has a diagnosis of a brain tumor. Oftentimes, the need is greater to have support. Go ahead, Diane. I know you're never short on words, so what?
No, I was just listening to the story, and as you were going through the story, I just had a feeling that it was your story, the way that you were talking about it, and how your interest in helping other people who are entering that same journey to guide them so that they're not as lost as you were in your journey, and just how the doctor should have given the diagnosis, not you.
Yeah.
You know, that's what his training is.
Right.
You know, you should have walked in there together, but it should have been for him, not for you.
Right.
And we were kind of the opposite. When we were upset, but our surgeon calmed us right down. He gave us the confidence, and he sounded so confident that I walked out of his office that first day knowing this is the guy that I want, you know, no matter what.
Right.
And he made me feel like, you know, no problem.
Right. Yeah, and I think that's an important aspect of meeting needs. I don't know if you were able to hear back here, but he was saying that he felt his doctor had a lot of confidence and really put him at ease. And you know, certainly when you're dealing with medical issues, that's part of the biggest support that you can get would be from your doctor or from your healthcare professionals, that, you know, when you have confidence in them and they're reassuring you, even if they're not promising you, you know, the wonderful outcome that you may want, at least, you know, somebody's reassuring you that they'll be with you and they're, you know, supporting you through it. I think that's invaluable.
And he never ever did not come to the phone or call you back. Or,
Right.
You know, he was just awesome, and he wasn't beyond reach. I guess that's what I'm trying to say. You know, he talked to you on a level that you could understand, even though he was like the guru at Columbia for this particular kind of tumor that Jimmy had. And just every time we see him, you know, it's just so nice to see him, and we didn't need that second opinion.
Right.
And you didn't worry about network or anything. Even though he was out of my network, he was the guy we wanted, so that was the guy we were going to,
Right.
you know, he made us feel.
Okay. How many of you have that confidence in that relationship with your surgeons or doctors or medical people? You do?
Yeah.
Yeah.
Very confident.
You know, I would like to say something about Florence. Wayne doesn't get his treatments at London, but there was an incident where there was an issue, and we were able to reach Florence. I mean, she picked up her cell phone, and you were getting into your car. And I was absolutely panicked over what we had heard and what we needed to make a decision about. And Florence was, it just helped so much, and it meant so much.
Right. Right. And that's a perfect example.
Yeah, it really does. It really makes a tremendous difference what you did.
Yeah. Yeah.
Florence and I, we communicate by email. No, because when there's a question, you need an answer.
Right.
It's the easiest
We just
way.
communicate with a smile.
Yeah.
Every time I
That's
see
the
Florence,
easiest
a
way.
smile.
Yeah. Right. And that's nice.
That easy.
Right, and what you're saying is that what I'm hearing is you're talking about calling Florence on her cell phone, which I actually don't have her cell phone number.
She didn't give it to me.
And you know, so it's cell phone, it's email, and I think that's really, you know, and a very important aspect is that it sounds like, you know, your healthcare professionals are accessible. And
you'll get an answer.
Right, and so and they'll also be able to communicate in the way that's most convenient for you. So you're saying email is best, and sometimes, you know, whether if you're the caregiver especially, sometimes the only time you have a moment is at night, and so, you know, we're not going to call Florence's cell phone at 12 midnight, but if you email in and you get a response, and I think that's huge.
Well, when you have it in writing and you can go back and read the directions over and over again, and you know you're giving the meds at the right time, at the right dose, it's just reassuring. Right. You know, rather than, did I do it right?
Right. Yeah. No.
You know?
Well, we're grateful for Florence.
Oh, yeah.
Yeah, and that's such an important part, because, I mean, that's the other aspect. And I mean, I can go on because, you know, I've done trach cleanings and I've done all these things with, you know, and I never really felt, you know, super accessible. You know, that I never had a, you know, a doctor who was, you know, super accessible, or, you know, I never had a nurse's cell phone number. You know, I could only imagine how comforting that would be.
It's a scary time, and it's like you have to make decisions quickly, and
Right.
And it's scary, and to have someone there that knows what they're talking about and kind of talk through it and explain things makes a tremendous difference.
Right. And you'll find that, I'm sure Florence will agree, that oftentimes when you're in a hospital setting, you know, people will end up coming to the emergency room more often, not necessarily because they're sick, but it's that those questions and those fears and those anxieties of if you're doing the right thing, and you know, when you go home with a list of medications and there's schedules, and you know, you love when some are on an empty stomach, some are on a full stomach, the seizure medication needs to be exactly at a certain time, and you know, it's enough to really, you know, make somebody crazy. So to have, you know, a medical professional available is a huge support. Yeah. Nice of you to join us.
Cell phone number accessible to all my patients and family members. I want them to know that I'm always there if they need me. They can
Right.
always call me.
Right.
Anytime it's not 12 midnight.
At a certain time, she shuts her phone off.
Can't blame her.
Feel
Right.
peace and comfortable that they have somebody that they can call.
And we
Right.
do.
No.
Thank you.
No. And that's great. Does anybody else have something to add? No.
I think there should be another phone number somebody can, a wife can call and, how's it going to be a pain in the ass for the rest of his life like that?
Well, that's an easy answer.
Oh, this steroid is going to wear off eventually. It's going to be normal.
Yeah.
Redefine normal.
It's true. It's true. They need to redefine normal.